Provided that everybody follows the guidance now, and everybody sticks to the measures that we have now, then we think that by the middle of February, then there really is the prospect of beginning the relaxation of some of these measures.
It seems so easy, just follow the rules, but what we're realising is it's far easier for some than for others. If you're living comfortably, working at home, and you have a cough, there's every chance you'll go and get it tested, even just as a precaution. But supposing if you have no job security and cash is very tight, what are the chances you ignore that same cough?
Not everyone is able to work from home. Not everyone is able to take time off work for self-isolation. Saving lives, restarting the economy also necessitates addressing these inequalities. And given the new variant, this might be the difference between a lockdown bringing R down below 1 or not.
Well, headlines were focusing on the increased transmission potential of the new variant coronavirus. A Public Health England report was quietly released a week before Christmas and pointed to other factors that drive transmission. At the heart of it was inequality. It highlighted factors including insecure public-facing jobs without social distancing, overcrowded housing, chronic stress and pre-existing health conditions as all contributing to an increased risk from COVID. The country applauded our NHS heroes last spring, but there are so many other essential workers keeping the country ticking through lockdown, in factories and food production, for example. They're essential, but are they treated as such?
Really precarious essential workers, we've not thought about their position at all. Lockdown widens inequality in two ways. It widens the difference in how likely you are to be at risk, and it widens the inequality in whether you're actually ill.
In Toronto, they've looked at infection levels among essential workers, such as people working in public-facing jobs, such as shops, deliveries and also manufacturing and agriculture. The blue line shows those infection rates amongst the communities with the fewest essential workers. The orange line covers the middle third of communities, and the red line shows how infection is significantly higher among those communities with the highest number of these workers. Should we just accept that transmission will always be higher in some communities than in others, and that lockdown may be increasing that gap?
It's just what's happening is that they're reducing contact rate more amongst those folks that were already at lower risk and reducing it less amongst those folks that were at higher risk. And thus we see those disparities just worsening. And indeed, in the sense of actually reducing overall transmission, they can't work in the way that they've been designed.
There are over 8 million essential workers in the UK who simply cannot work from home. Blunt tools such as lockdown with its associated trade-offs can only work effectively if it stops transmission in the groups transmitting. We drove COVID infection rates right down last summer, but what experts have said is where the embers remained hottest was in the deprived communities. So what do you do about it?
I think we need to think about support proportionate to the risk of exposure of an individual. We need to think about additional layer of support for disadvantaged communities. Income relief. At the moment, only 1/3 of salary is recovered when you're off sick. And we need to think about how we can incentivize sectors. We need to think about whether to provide accommodation for people living in overcrowded housing or people who don't have a house to self-isolate.
The UK has one of the lowest proportions of pay covered by statutory sick pay in Europe, and millions don't even qualify.
I think when we get into it, we understand that, the sort of systematic and structural barriers that put folks at risk are really at the heart of effective interventions rather than this idea of blaming folks. But indeed, it's natural for us as societies just to blame individuals, I think, rather than tackling difficult and challenges issues.
Understandably, our politicians have spent a lot of time trying to make people do as they've been told. But some are asking whether there has been enough effort thrown at people in those areas where, without help, the virus is likely to thrive.
Deb Cohen with that report. Well, we invited the government on the programme. They declined. A spokesman told us they're doing everything they can to ensure their coronavirus support reaches those who need it most. Joining me now is Rose Gallagher, the professional lead for infection prevention and control at the Royal College of Nursing, and Zubaida Haque, a member of the independent SAGE, formerly acting director of the Runnymede Trust. And good evening to you both. Rose, if I can just start with you to paint the picture for us, if you can, of what you're hearing it's like currently on your wards.
So what our members are telling us is that the pressure is absolutely relentless. Nurses and midwives working in all care settings and care homes have been working to support this pandemic now since March. And working in a pandemic is very much like running a marathon. You need pace, you need rest if you're going to reach the end. But our members are sprinting and they are absolutely exhausted.
And it's a marathon in the sense that we actually don't know how long this could go on for. I mean, Nick heard figures, I don't know if you heard that earlier, that the laws will be in place until the end of March, which sounds like the beginning of April. We've been told mid-February. I wonder, Zubaida, how you manage to get people to follow a set of rules when there are such severe economic consequences for some who are trying to do so.
Well, that's absolutely the key point, Emily, which is we have been saying from the very beginning, Independent SAGE have been saying that in order to get people to adhere to rules, we need to help support them. As you rightly pointed out at the beginning, this isn't just about will. This is about being able to being able to adhere to the rules. And we know, for instance, right from the beginning that Black and ethnic minority people in deprived areas were much more at risk for COVID-19, much more at risk of severe illness and death because of the types of jobs that they were in, because of the types of accommodation that they live in, because they're much more likely to live in overcrowded housing and so on. Now, all of these things matter, but what also matters in this pandemic is stopping transmission. And the way we stop transmission is to get people self-isolated. And we've known from the beginning and throughout this pandemic that people in deprived areas, that people in low-paid jobs, that Black and ethnic minority people who are disproportionately in low-paid jobs and insecure jobs have been less likely to afford to self-isolate.
So let me ask you, what would you actually say to people in that position? Would you say, you have to self-isolate? I know it's really hard. Or would you understand that some people will have to break the rules and will have to go to work and obviously will live maybe in multi-generational families where they can't make those kinds of decisions? I wonder what message you would give out.
They shouldn't have to make that choice. I mean, the whole point of the government is to help us in this pandemic, is to protect us. We know that Black and ethnic minority people, we know people in low-paid jobs, we know deprived areas have had to make difficult choices between going to unsafe work and putting food on the table. Now, the government have been in the position to help them. They've helped other workers.
They would say, to be fair, they would say they've given, what, 280 billion to protect the livelihoods of people and 50 million to help those on low income. So, I mean, the cash has been put there for this.
It's not been enough. As your colleague has rightly pointed out, that actually nearly 2 million people are not eligible for statutory sickness pay in this country because they don't earn enough. Now, those people are disproportionately in insecure jobs, are disproportionately in zero-hour contracts, and they're disproportionately women. And this government haven't done enough. They haven't given enough statutory sickness pay. They've made the eligibility criteria very high. And we know from the Liverpool mass testing, Dan Carden, the MP, spoke about this, that in the Liverpool mass testing, pilot, only 4% of people in poorer areas came forward for the testing because they were too afraid of getting the result. And that's because they couldn't afford to self-isolate. So it matters.
Rose, let me turn to you, because lockdown is essentially a holding pattern for all of us until we vaccinate everyone. From what you've seen on the front line, is the NHS being used efficiently for that? Are you happy with the logistical process that's going on there?
Well, the vaccination programme is a huge logistical challenge, but the plans are there. Of course, we must remember that we've only just really received the Oxford vaccine, so it's early days now, but there is a real commitment across the UK to get this to as many people as possible, and GPs, nurses in hospitals and other healthcare workers are all part of that. We also know that there are many non-healthcare workers that have signed up, such as volunteers through St John's Ambulance, to also help this effort. But I would just also like to make the point that if this vaccination programme is going to be successful, we do need to protect the vaccinators as well. So as we have high rates of sickness and absence in the NHS and in the independent sector and care homes, what we can't have is our vaccinators off sick because they are self-isolating or have COVID themselves.
Keir Starmer raised the point today that, you know, if we are throwing everything at this, which understandably we are, then we should probably be doing this round the clock, shouldn't we? I mean, this should be a sort of a military strategy of getting every volunteer that's offered their name should be, you know, called up within 24 hours. There are some people that you hear from who offer their services and have heard nothing for 3 weeks. I wonder if you think it should have that sense now of, if we're all staying at home for the most part, then are we throwing everything at it? You know, 24 hours a day, 7 days a week now.
So it's very much being approached like a military operation, and the military are supporting testing. As you know, not everyone would want to accept an appointment 24 hours a day, and some people simply could not get to appointments 24 hours a day. But certainly extended hours and flexibility is absolutely crucial to its success.
Zubaida, do you think that the way we're prioritising is right at the moment? Clearly, it's the vulnerable age demographics that are receiving the jab first. Would you change that order? Would you do it in socioeconomic or ethnic demographics to get priority access?
Well, Emily, would you mind, first of all, can I just say one thing, which is we're focusing only on vaccination and only on lockdown, just as the Prime Minister has. And Independent Sage would argue, and have argued consistently, that those must not be the only two things. Those are not the only two things out of this pandemic. What we also need to do is improve the contact tracing and the support for self-isolation. Now, in terms of priority for vaccination, that's a really difficult question, because we know that that depends on multiple factors and multiple risk factors. So the reason over 80-year-olds, for instance, are being prioritised for the vaccination is because age is a significant predictor of risk in COVID-19. Now, with ethnic minorities, it's much more difficult because there is no one gene for being black. There is no one gene for being Asian. And it's not that one gene, that the genetics that is making black and ethnic minority groups, or even people in deprived groups, you know, those aren't the situations, those aren't the characteristics that are making them vulnerable. So, of course, it needs much more care. What I would say is if the government focused on the fine test, tracing, isolate and support. And it's the isolation and support, the supported isolation that matters the most. Then that is also going to get us out of this pandemic, because that will suppress the virus and it will keep the virus down.
Those are the very much indeed. Thank you. Thanks for joining us.